everybody. Welcome back to the Lady Leader series. We are excited to have back with us Rachel Wall, who has been like such a favorite, I think, for so many people. We get so many questions about hygiene, and she's really kind of all things hygiene, everything about making a profitable hygiene department, because she is one. So she is such a great
Yep.
source for us. So we're so thankful that you came back, Rachel, and always make time for these sort of things. So thank you so much for being here.
My pleasure. Thanks for inviting me.
Absolutely. Tell us real quick a little bit though about your company, just for people who maybe don't know you.
Yeah, so Inspired Hygiene, we are a boutique coaching service. So we offer continuing education. We offer in-office coaching, really holding your hand as you're really developing and elevating your hygiene department. We've now coined the term the Inspired Hygiene System. So we help practices implement that help the hygiene department continue to up level. And we believe that everything that we recommend and that we're asking teams to do has to be a triple win, right? It has to be a win for the patient, for the provider, and for the practice. And we'll talk about that a little bit this evening as well. Next year, we're celebrating our 20th year anniversary as Inspired Hygiene. And yeah, I'm a hygienist of a long time. Let's just put it that way, way more than 20 years. And I was just doing the math today, just confirming a couple things. So we've coached clients in 45 states, and I'm
Wow.
really proud of that. Yeah, and it's been over that course of time, but I'm really proud of that, and I'm really proud that they get dramatic results. And it's not us that are doing the work; it's just us facilitating and guiding them. They're the ones that are, thinking differently about the impact that they can make on patients. They're the ones that are communicating, treatment that's in their patient's best interest. They're the ones that are really making it happen. I'm happy to be a part of that.
Yeah.
Yeah,
Well, and you couldn't be in a better place because, obviously Ashley and I get to talk to a lot of doctors in DSI and DSN. And like these are the doctors that I was just
I
telling you
know.
before we got started. Like so many of the doctors I just had coaching calls, even just this week, hygiene has come up and they so desperately want to help their
Yeah.
hygienists have the most impact. So this is really just the right place, I think,
Yep.
for you to be. And hence
I
that's why you're
agree.
back yet again.
Yeah,
So
I agree. I'm happy to
um
be here.
yeah, and Ashley, everybody knows you, the GSD queen, who is always on these with me to bring her perspective, which, like I said, you talk to a lot of doctors too. So it's nice to have your perspective as well. So I'm glad we're all here. So,
Ditto.
all right. So I'm just going to kind of dive in. And, everybody knows that all of us are really about being able to have just positive impact on our patients' health. And I think that's the focus of it all. I just talked to a doctor who was, talking to me about, oh, how do I have my hygienist embrace metrics, KPIs?
Mm,
And I said, you don't.
mm-hmm.
I said, you have them embrace what's the highest impact they have as
Mm-hmm.
a hygienist, and are they committed to that? Because I
Mm-hmm.
said, really, you don't want to make any KPIs or metrics until you've actually talked to them about what's the highest level of impact you can have in this office and how do you deploy it. So that's really what we're going to be digging into, knowing that that's the bedrock foundation is impact on patients' health, not necessarily the profitable hygiene comes as a wonderful side
Yep.
benefit when really it's just the high impact and health
Yep.
standpoint. So
Yep.
knowing that that's the bedrock, what are you seeing? And I know you just got back with some really current information of like, what do you see as some of the adjuncts that offices could offer that
Mm-hmm.
perhaps they're not or they don't know about? So let's start
Mm-hmm.
there.
Thanks, thanks, Summer. Yeah, I agree with you wholeheartedly about that, and we certainly don't want to lead with the KPIs or the production because that turns hygienists off. And it's just often because, and I don't want to say, I mean, I'm a hygienist and I own a business, so there are hygienists that are entrepreneurial minded. I'm going to say that's not the norm. And so they just don't have the perspective to understand that those KPIs, and again, this is not all hygienists, because I know we'll have some very savvy hygienists that are watching. They don't always have the perspective of the business owner to know why we're measuring those KPIs. And what we really say is those are a gauge for the impact that we're making on our patients. So, if our peri percentage is super low, then we're not having an impact in that particular area, and where's there room to grow that. So I love setting it, in, like you said, as that as the foundation. So what I would say is what adjuncts or practices incorporating. Most practices now, again, I have to remind myself that the the practices that engage with inspired hygiene that are in DSN are not the average practice. We are surrounded by all of us all the time, so we think, well, this is just how every practice is, but that is not the case. I would say that these practices are in the top 10 to 20% with regards to just the attention that they're giving to their business and to their team and their patients, and then that drives that, business result. But I would say even the practices that we talk to, most of them are not incorporating adjuncts
Mm.
in hygiene. I just talked to a very high end practice today that's been around for 40 years, and they very much care for their patients, but because they've got a huge scheduling obstacle, they're 1% perio, and they're not instituting any adjuncts, right? It is a perio trap, and that perio trap really is not good for anyone. It's not good for the patient because they're not getting the care that they need. It's not good for the providers because they feel like they're on this hamster wheel all the time and getting burnt out. And it's not good for the practice because a lot of times the hygienists are doing some level of therapy, but they're not billing it out, and the patient isn't even aware of what's happening. And it creates this whole weird dynamic that happens a lot. So, the really proactive practices that we see are incorporating some type of either diagnostic adjunct like a salivary testing, a pathogen testing. They are incorporating some type of antibacterial, antipathogen adjunct to enhance scaling root planing. We'll talk about some of those. And they're incorporating some type of preventive adjunct is typically the case. So diagnostic, therapeutic, preventive. And then we can go into the detail on a lot of those different products and services.
Okay. So what I'm hearing you say is that a lot of offices aren't necessarily able to offer adjunctives, or that's just not even maybe on their radar.
I
Um,
would say that, yes.
okay. Which is great because hopefully they're listening to this and they're at least just going to get some ideas. And I'll throw some out too that are ones that we've found really easy to
Mhm,
incorporate. But pathogen testing, preventative, um, uh, support, maybe we're going to get into,
therapeutic, mhm.
yeah, therapeutics, you said
And then
too.
there's the home care too, there's that whole side too.
Okay. Yeah.
Mhm,
Well, and we may be able to touch on too, even just, I mean, I don't know about you, but like sometimes when the perio percentage is super low, that's in and of itself one of the, I mean, the first place to kind of start.
absolutely,
So
absolutely.
it's not an adjunct, but I always tell doctors, and we kind of briefly were talking about this before we started, but there's really like, once again, if we just go bedrock fundamentals, I almost think trying to throw more at an office that has a really low, say under 15% perio,
Mhm,
unless they're a really young demographic, and I'm talking like under 30, like for me, it's almost like maybe don't add more adjuncts.
yep,
Instead, let's focus on getting the people healthy in the practice that are
yep,
there first through the perio protocol.
yep,
So, you know what I
yep.
might do, Rachel, and I hope it's okay to switch just gear for a second. Tell me when you're talking to offices that you see that their perio percentage, because I just got asked this, what's a normal perio
Mm,
percentage? And
mhm,
I'm always like, well, that really does depend on the demographics. But we all know
mhm,
the World Health Organization, what they have said about 80% of people over 30 have some form potentially of gingivitis,
mhm,
inflammation, or perio. So
mhm.
knowing that, what do you tell offices is kind of what you're looking for?
Yep. So we say at least 35% is perio related, and we have a simple math formula, right? That is scaling a root planing plus perio maintenance plus prophy divided by, and look, it's 5 o'clock somewhere, so it's 5 o'clock here. So divided by the scaling root planing and the perio maintenance, or some configuration of that. So it's a percentage of procedures of those three that are perio based.
Yep.
And we shoot for at least 35%.
Okay.
Now, just because you're at 25% doesn't necessarily mean you have a healthy perio program, because one thing that we see is maybe if you've inherited a practice or you did some coaching in the past, you might have a lot of patients that are in perio maintenance that are carrying that perio percentage and very few that are going through active therapy. And sometimes practices get stuck in a perio maintenance trap where every patient's in perio maintenance, or a lot of them are, and we just don't know what do we do with them if they're now not healthy. And sometimes we also think of patients as stable, but if you have somebody look at it from the outside, they're like, well, yeah, they're stably diseased. Like, this patient's have the same 10 bleeding sites for the last 3 years, and we haven't done anything to change that.
Mm.
So I think it's always trying to look at these patients with a fresh eye. And so I would say that is the perspective. And yes, the AAP, ADA, World Health Organization says anywhere between 50 and 80% have some level of inflammation. And if you look at the AAP definition, there's a paper in that whole World Workshop website, right, where they created all the staging and grading new standards. There's a paper in there called Perio Health, and it really clearly says, like, the only way we can really consider someone periodontally healthy is that they have absence of inflammation. And that's very few of our patients. Now, that doesn't mean that every one of those patients needs 4 quadruped scaling and root planing, right? They might need education. They might need a shorter interval. They might need gingivitis therapy. They might need full-on periotherapy plus lasers plus periprotect or whatever it might be. They might need surgery. So there's a wide range of ways that we can address that. But I think if we look at it that way, probably very few of our patients are truly healthy.
Yeah. Well, and you just touched on maybe along with that bedrock foundation of our impact on patients' health is the biggest deal. We can no longer, ignore the oral systemic link
That's
we've
right.
talked about. So knowing that, maybe the first step is before even throwing some of these cool adjuncts that we're talking about in, is really dissecting your perio percentage,
Hmm.
what the protocol is. We use the AAP, that is kind of what we used as our guidelines. We made sure all our hygienists understand. We checked how they probe. We really made sure,
Yep.
like, okay, does everybody understand what these guidelines mean and what constitutes true health? Because from that, that's actually where these adjuncts now come in.
Hmm. Hmm.
You can't necessarily throw the adjuncts in before we've talked
Hmm.
about, perio percent and what that actually means.
Yes, I would say specifically if they're peri-related adjuncts. I mean, there's others, right, that we can talk
Sure.
about from a tooth disease standpoint. But yes, 100% agree. And when we coach clients, we work on the foundation first, and it depends on how far ahead they are. Like, some are starting from the very basics, and then we may not introduce any adjuncts for several months after they've just been getting that under their belt and they're getting confident and having those those conversations with patients and comfortable with their verbal skills, and then say, okay, now it's time to layer this on top of that, because then they've also gotten some confidence, and because patients are accepting treatment more than they expected they would, and then we can kind of help that. So it's always, I think anytime we're incorporating these things, it is always important to be there very thoughtful about it and give your team time to kind of absorb it and get it into the workflow and have it become comfortable before we put another one on.
Yeah. Absolutely. Because a lot of times doctors tell me all the time, well, I'm giving them all these cool resources and they just don't use them. And I'm like, I don't think it's that they don't want to use them. I think they
They don't
don't
know where to
know
start.
where to
Yeah.
start, how to incorporate it, when to
Yep.
incorporate it, what codes to charge out
Hmm.
for, how to treatment
Yep.
plan it, and the verbiage associated. So I think
Yeah.
sometimes more is not more.
That's right.
more
So there's
more
yeah.
often becomes less.
That's right. And so if you have one and you have a process around how we're doing this, and then it really becomes ingrained and they believe in it, then you've already created a foundation for adding the next thing. You just have to invest in that. You have to invest in that process creation, the trust, the communication, and the results too, right? And not every adjunct that we use can we see clinical results immediately, right? So with something like lasers, antibacterial, local antibiotics, those kinds of things, we can often see the results within 6 months of that. But that's not true with everything. We don't always see with fluoride. We know the statistics We know what the populations have decay rates that don't have fluoride versus those that do, right? And we see that, but it's hard, we don't see an immediate response with that because we're preventing a problem from happening in the first place.
Right.
Yeah.
Right. Yeah. So I think really what we're kind of saying is get the foundational bedrock of your, periodontally, get your protocols, make sure all hygienists know it, and they feel comfortable just talking about perio before potentially we start throwing in adjuncts, especially that are supportive of helping perio conditions.
Yeah.
Unless you've
Yeah.
got a good foundational perio protocol, they know what to do, with a 1 to 3 teeth versus a, 4+ teeth. They know a
Yeah.
gingivitis code versus a healthy mouth cleaning. They really have good understanding of every patient, what delineates them as some sort of inflammation or not. So that might be the first place to start before you have the now let's throw in some perio involved adjuncts,
Mm-hmm.
especially, or even potentially other adjunctives. This is just a great place to ensure that your patients are healthy. So I think, Ash, anything that you can throw in there that you
No, I just thought it was really interesting, the perio maintenance trap. Like I was taking,
mm,
like, I just think that that's an interesting thing to note when people are like, oh, it's doing so well. And it's like, but is it
Is
like,
it? Mm-hmm.
yeah,
Mm-hmm.
so, I thought that, yeah, I just
Yeah.
thought that
And
was
here's the
interesting. And then of
thing.
course go ahead.
No, you go ahead.
No, I had a different subject. So,
Okay, so that I'm tempted to get in the weeds, and I'm gonna try not to do this. But here's the thing. Again, it doesn't mean that, that if you look at the definition of periodontal maintenance, there is some limited scaling and root planing that can happen there. A lot of times, though, the patients have passed that point. They pass that point. And I would say the other thing that's really helpful that we really do is it's helpful to not come at the hygienist and say, well, the AAP says 50%, so I mean, they must be 50%. So, on one hand, it's not statistically realistic that 1% of your patients are going to have disease, but it might not also be 50%.
totally.
So, I think establish what is health versus disease based on a credible resource like the AAP, and then ask, okay, so if we're looking at this, what percentage of our patients do fall into this category, and how does that compare to what we're doing right now? And then all of a sudden they're discovering for themselves rather than, somebody telling them. Yeah.
Absolutely. Well, and it's like comparing yourself with other people versus comparing yourself with your own best version. It's like it's the same way. I'm like, no, look at what you have in front of you. Yes, that's like a nice number to potentially keep in mind, but it's just a number. You have to go with
Yep.
truly what's in your practice and what's in front of you. And it's a
Yep.
patient, not it is a number, but
Not a
it's a
number.
patient. So
Right. Right.
so yeah, so well, let's get into then, let's say somebody's got a really solid perio protocol. Their hygienists are really looking for ways to get patients healthier.
Hmm.
Let's go
Hmm.
through some of the ones you just said that are some of the kind of cool adjuncts that can be offered along with
Hmm.
this.
So I would say, we recommend approaching some of these adjuncts right off the bat. So, sometimes we want to wait and see, what's going to happen. And there is there's merit to that, right? To see how the body's going to respond. But if we have a patient particularly that has other risk factors, then they have inflammatory burden, right? Whether it's periodontal disease, they have diabetes, they have stress in their lives that they're telling us about. They have, high blood pressure, they have some type of autoimmune condition. Those patients have likely a compromised immune system to begin with. So why wait to see how their gums are going to heal? Why not give them the benefit of the doubt or the benefit of the additional therapies to really jumpstart that and help them have the best result? Now, if you have a patient that's coming in and they're that, I'm going to say, grade A patient on the staging and grading, where maybe they have a lot of calculus and it's been 10 years, but they have very little bone loss. They've got some bleeding. They're just starting, and they're going, when you do scaling root planing and remove that local irritant, they're going to heal really nicely. And they might get a great result with scaling root planing alone. So looking at the patients individually and then really deciding what approach to take. But I would say the ones that we see that have the most benefit are going to be PerioProtect for home maintenance of those pathogens and keeping those levels down. Also, there's a new product out called Hibernex, and it is a desiccant that kills the pathogens. It also dries out calculus, so it makes it a little bit easier to remove. I've used it. It's very easy to place. It's cost effective. You can treat um, like a whole arch, in a really cost effective way. I think Arrestin is still effective for addressing inflammation, very localized. If you have something that's very localized and you want to address that site of inflammation and get that bleeding down, that's still effective. Lasers have efficacy, and everybody has um, there are different approaches to utilizing lasers. And here's the thing is there's science on all of these products. And there's also ways that you can poke the hole in the science of all of these products. So we have to also pay attention to our anecdotal results, the things that we're seeing in our practice every day, because it takes a long time for a research study to catch up with what you're seeing in your practice. So if there are things, I think we're doing our patients a disservice if we don't at least give some of these things a try. And there are some of these that are very affordable that you can charge the patient the cost, right, while you're kind of proving to yourself the results. And if they're not having results with scaling root planning alone, maybe you've referred them to the periodontist because that's another option. And either they can't get there, it's too far, they're not willing to go, whatever that might be. Like what's the harm in giving them another opportunity to heal? So I don't know what your thought is on that, just from the research and the science-based piece of that.
I couldn't agree more with you. Obviously, I'm emphatic about everything, but I was emphatically shaking my head that, sometimes I bring things like this up and I'll always have people who are like, well, that I heard that doesn't work. And I'm like, I couldn't agree with you more. There's research that's going to support it, and there's always going to be things that are going to poke a hole in it. And, what I can tell you is we've used some of these things. And when we watched and got those patients back, the majority got better. They
Got a
got
result.
healthier. Yeah.
hmm
And so that's where for us, exactly what I was going to say is anecdotally, a lot of these things have worked exceptionally well. Now,
hmm
sometimes it's in our hands, it's operator, especially with like a laser. There
hmm
is some, operator error that could
Sure.
potentially happen. But by and large, we've gotten great results. And we are the practice that, I live in the mountains of Colorado. I
hmm
am the practice that sometimes they're like, I am not going to travel 2 hours to a
Yeah.
periodontist. So my hygienist, we've had no choice but to become this
hmm
practice that we do deploy a lot of things that we
hmm
can, and lasers are one of them. But so is perioprotect and a lot of the things that you just discussed. I did write down the Hybenex. I hadn't heard of that one. That's pretty cool.
hmm
Um, but yeah, I couldn't agree with you more that please know as we're saying this, we very much understand that there's going to be ones that work great in people's hands and there's ones that don't. There's going to be
Yeah.
ones that you're going to have great results with, but it's worth trying. And like you said, even offering them at cost just to get your hygienist comfortable with trying some of
Yeah.
that.
Yeah. Yeah. Or a fee that's maybe a little above that, so you're covering other costs that you have in the
Sure.
practice that's not just the product. But the whole point of all of this too is that triple win again, right? Because you want the hygienist to be engaged. It's exciting when you have new tools in your tool belt, right? It's hard when you feel like I'm doing the same procedure and I'm not getting the results that I'm looking for. It's that whole like doing the same thing over and over and expecting a different result. So it's helping the hygienist work at the top of their license, and having some services that they can offer that's going to impact patients, and helping patients get healthier. And then again, ultimately, it's going back, to those results for the practice. So yes, I would say that those are things that we're seeing commonly and that we're teaching our clients with regards to perio. Now, when we look at the other side of this from a preventive or reparative standpoint, obviously fluoride varnish is one of our mainstays. And another product that's out on the market, and just for disclosure, like uh, PerioProtect, we do have an occasional relationship with them, just sponsoring speaking in some of our programs and things like that. We don't have any relationships with any of these other products yet. We may in the future. But Curadont is a product I was going to say a product to watch. I'm going to say it's something to take action on. It has been in Europe for years. It's been in the US now for about a year. All of the dealers have it sold through the dealers. And it is a enamel regeneration material. It can be placed by hygienists. It's very simple. I've placed it on my son, and it's used in areas that you would watch. So
Mhm.
early decay that you might watch, even things that you can see on the radiograph, but it hasn't broken through the enamel yet, or even into the dentin especially. So there's a lot of science behind that as well. If you look up Curadont, JADA articles, there's a systematic review that came out earlier this year, and then there's a new article that just came out in the latest issue of JADA as well, on these products, and it's peptides that create a scaffolding, and then it pulls hydroxyapatite from the saliva to really rebuild enamel over some of those, early lesions. So this is something that, helps prevent a lesion from going where we know it's going to go. And sometimes with proactive dentists like are in this group, if you see it on the radiograph, even though it hasn't broken through the dentin yet, you might say, well, let's go ahead and address this so that it doesn't get to that far, right? And that the restoration can be as small as possible. But now we have another option, and these can be placed by hygienists, and it's same day. It's very simple, it's very quick, it's painless, there's no taste. I mean, it's really pretty remarkable. Yeah.
How do you actually place it? What's the vehicle for placing it?
Yep. The vehicle is, it comes in a vial with a solution. Actually, I believe the peptides are actually on the sponge. So there's a little sponge on a tip, and then the solution activates the peptides. And
Okay.
so then the sponge is placed directly on the lesion. You can kind of shove it in between interproximal. You can place it in the occlusal surface, and you just kind of wring out the sponge. So all that material is going into the enamel. You do etch it first. So you etch it, and then you have to keep it dry for about 5 minutes after you place it.
Okay.
And
How
that's
do
it.
you
There's
how
no
do you suggest
curing.
keeping it dry, especially if there's like a kiddo, a 7-year-old with a first
Yes.
molar? How do you
Yes. So
isolate?
just, yeah, isolate whatever type of isolation, that you have. It's going to take, if it takes you 5 to 10 minutes to do a sealant, right? It's going to be about the same amount of time or less, way easier. So yes, I would say whatever
Okay.
mode of isolation that you're using, isolate's perfect.
Okay. Okay. So
Rubber
that's
dam, whatever might work. Yeah.
sure. A lot of us have, yeah, because of everything with COVID, a lot of us have lots of isodries. And
Yes,
I joke, I'm
exactly.
like, I wish I would have come up with those things because during the
I know.
pandemic, when we were short
There were,
staffed, I'm like, I feel like I have them everywhere.
I know. Pick the one you want to use today.
Yeah, yeah. So okay, that's a great one. Perio Protect. For everybody who doesn't know, those are the custom made trays you can use an
Yep.
iTero scan, send them in.
Yep.
Yep. They work great. We use those. They work really
Yeah.
great.
Yeah,
Um,
and we just did I did a training yesterday for Kane Waters for some of their planners on hygiene production. And as we say, whoever does the scan, right, gets and places the order, gets the production. So with the iTero or any of the scanners, it's very easy to do that for the Perio Protect trays. I mean, obviously there's a learning curve with the scanning, but if you're comfortable with that, you can certainly do that. And it is custom trays. They have a seal that keeps the hydrogen peroxide solution down into the pocket while the patient is wearing it. Um, it's also great for patients that can't brush well. As long as you have somebody that can help them be, my mother has dementia, and so she has PeriProtect trays that we make sure that she uses, several times a week. And I will tell you, it has helped her stay stable and healthy 100%.
totally. Yep.
Yep,
I couldn't agree more. And I always tell people the really lovely side benefit keeps your teeth really white.
that's right. And your breath
So
fresh.
yep.
Yep,
So it's pretty great.
yep,
Hyponex, you said, is a desiccant that you can actually have hygienists can place.
yep, yep.
Okay.
It comes in a gel or a liquid. It comes in a little syringe. So you can just place it. One syringe will probably treat at least an arch. Now, and if you had, let's say you had 5 or 6 localized periodontal, sites throughout the mouth, you could use it on all of those. And I think the cost to the practice is probably between $35 and $45 for a syringe, so it's very affordable. Same with Curadont, it's about $30 per site. I'm sorry, per vial, and you can treat 1 to 2 sites with that. So, like, let's say you have 2 teeth that are next to each other, and there's a starting interproximal lesion, you could treat both of those sites there.
Okay.
Um, Curadont is going to have its own code next year. So they're really excited about that. And Hybenex is now using the 4381 code, but they're pushing for another code that's a little bit more specific to that product. But it is a localized, antibacterial product. So yeah, could use that same code.
Okay.
And then there's just a number of amazing home care products too, and just all of those things to really, like you said, help patients get
Okay.
healthy.
Yeah, for sure. So when you're talking to offices, right? You first start with the perio, you first start with the impact, everything we started this thing with. These are some of the products that you discuss with them, but tell me, like, if you were a dentist, how would you actually start incorporating these? If this is a doctor listening right now and he's like, I want to use the Curodont, that's going to be amazing. My hygienists
Mm-hmm.
are going to love to have this opportunity.
Mm-hmm.
How
Mm-hmm.
do they actually implement it successfully?
Mm-hmm. So I would say always focusing on the why, right? So obviously that's something that if it's same day, it can have a huge impact on hygiene production. But start with the why and start by asking the hygienist, like, how many watch areas do we do a day? Or how many of these areas that, oh my gosh, it's just starting. Do we treat it? Do we not treat it? Like, what do we do? It creates a little bit of angst, right? Because, we've all had the situation where, you're a proactive dentist and you have a young patient that comes in, they're like, I've never had a cavity. And your heart just sinks because you're getting ready to tell them that they have 5 cavities. And you want to treat it so that it doesn't get any bigger, right? That's the whole point. Like, let's do this now so we can keep this as a baby filling rather than it becoming a mama filling. So, what are some of those situations that maybe you find yourselves in that you wish you had a solution for? And then now you do. So if this suits that certain situation, what if we had that solution? This is something that's new, that's out there. It's been in Europe for years. There's tons of data and science behind it. They have actually one. I was just looking today at one of the new study. There are a bunch of X-rays, like before and after X-rays. You can see the lesions starting to heal. So, I mean, to me, that's really, really cool. And you'll be able to start seeing that in your practice too over time, right? It might take 6 to 12 months before you see that happen, but there is documentation of that. So I would start with that. Same with like fluoride. Okay, what percentage of our patients have sensitivity? They have exposed root surfaces. They have a history of decay. They have, like, what are all the risk factors for where this product would come in and be a benefit? And let's just talk about the prevalence of that in our practice first. Okay, so now we have a solution, and how can this solution benefit the patient? Well, if we utilize fluoride, or if we utilize Curodont, we utilize whatever our solution is, it's actually going to save our patients money because it's going to be less expensive to treat it now than it is with a filling later, right? And instead of telling them, I would ask the team those questions, like, what if this is what this product can do, if this is scientifically sound and we believe that this can be accomplished, what are the benefits that would come to our patients? And have a flip chart or your whiteboard and just have your team shout them out and write them down.
Yeah.
Okay, so then why wouldn't we incorporate this? What are some of the obstacles that we might come against? And you're gonna, yeah, well, it's one more thing to do. It's, I don't know how to present it. Okay, so we can handle all of those things, right? And then you just start talking through those. So here's kind of the framework. I'm looking at my notes here because we got these kind of hammered out. Focus on the why before focusing on the production. Discuss the results, right? When you do start using something, discuss the results amongst the team, because otherwise you're not going to know. Like were just talking about your busy day. It's like from one thing to another, right? That's the way we work. Our schedules fill, everybody goes home, and then we come back together the next day. So at your team meetings, when you're incorporating new products, have a time where you get to share what the results are, because the hygienist might know from one hygienist to another, but the business team might know that, like, this is the first time, John has come in and his gums haven't been bleeding. Or, we've been doing all these watch areas and they come back and now it's time to fill it. Like, is there not something that we can do in between? So start sharing those results in the practice. Practice the presentation skills. That's the biggest thing too, is after the why, we don't know how to say it. What do we say? And a lot of times, if they'll do the training with the manufacturer, they'll give them the tools. Or if they work with a coach, right, they'll give you the tools on how to say that. So practice that within the team before you just kind of let loose on patients. So
Yeah.
spend some time, invest some time in that. Y'all want to add anything to
No,
those couple
that's
points?
always my
Okay.
biggest one. When I'm talking to doctors, I'm always like, it's actually the verbiage that I think gets in the way the most. And I love how
Yeah.
you said, we always start with the why. We always start with how amazing this is going to be. It's going to save the patient money.
Yep.
It's going to save the patient an appointment. It's going to save them time.
Yep.
So we know the outcome it has. Now let's practice how are we going to present it. And that's what's funny is a lot of times they all look at each other like, yeah, how are we? So I'm always like, doctors, before you go into that meeting, know how you would want it presented just to be able to talk it over with. You know,
Yep.
here's how I would present it is I would say, hey, we've got this product that's amazing and we're always on the cutting edge. And this is exactly what I would do for my kiddos because it
Yeah.
remineralizes that tooth structure and we don't have to cut into that tooth. It's pretty fantastic. And it's only $60. One thing
Right.
that I tell doctors is I know we don't want to have to talk about money, but one thing that I say is your hygienists are very aware of it. And that's one of their biggest obstacles is things that cost hygienists get a little phobic about because they're
Nervous.
clinicians and they don't like to have to know about money. So if we don't
Mhm.
make it super convenient for a hygienist to be able to say, it's only this much, your insurance may cover it, but regardless, it's only this much and
I
it's
know.
preventative. So
Right.
walking through what the verbiage is going to sound like. And one thing that I tell doctors is, you know, you're going to have this meeting once and you're going to tell them most likely, this is the verbiage to go and try to use this next week. I'm super excited, but here's what I need you to know is we're going to run into obstacles. That's fantastic because that means
Yep.
we're doing something. So when you run into
That's
those
right.
obstacles or you get that patient who looks at you with like you have two heads, I know this sounds crazy, hygienist, but that's awesome. Know in your head, that's awesome. What was the scenario that made it feel kind of uncomfortable?
Right.
Because we're going to role play that one.
Yep.
So bring all of those two-headed weird conversations to our next meeting, and we're going to do this again. So I almost like to prep everybody with it's going to be uncomfortable. We're going to have sometimes not, you know, overly uncomfortable, but it's going to be sometimes you'll have those weird conversations.
Awkward. Yeah.
Yeah, and almost expect it. And that's a
Yeah.
great thing because that just means you're actually having the conversations, and that's
That's right.
fantastic. Everything's going to be slightly weird until it's awesome.
Yep.
And so I think when I talk to my own team or I'm talking to doctors, I'm like, I think we want to incorporate things quick. And that includes like throwing it at them and saying, isn't this awesome? Aren't you guys so stoked? Here's the why. Hygienists, go get them. And then they come back next week and they've literally had one patient do it.
Yeah.
And over, how many times have you heard the doctors say, I don't get it. I don't get why they're not wanting to use this like I am. And it's usually stuck in the verbiage and those weird, awkward moments. And a hygienist gets shut down, has to talk about money and have weird moments. That's usually enough for them to be like, I know that it's great, but I don't want to do it.
I don't know what to say. And I
Yeah.
know this patient, and they're going to think I'm trying to sell them something or this. There's so many things that come up for us, right? And also they might not have been on the CE webinar that you took that the person was super passionate about it and got you pumped up, right? They're
Yep.
hearing it like third hand. So I would say the other thing that's really beneficial is, again, you're invest in your team incorporating this and know it is going to be a little bit awkward, and then help them like during the huddle. Okay, so I'm seeing like we had some watch areas, or who had watch areas last time, right? That we want to check today. And you're like, good news, you know, this is a watch area, and now we can do something about it instead of just waiting for it to decay, for example. And then here's the other thing too is, imagine if you have like AI diagnostics on your x-rays. I mean, that's just going to cut your conversation time in half probably, because it's just right there.
Right.
And now we have something to do instead of you know, having to do a filling.
Yeah.
So and same thing with perio, right? If we're able to see the bone loss, it's like, don't let this progress anymore. Let's do something about this.
Yeah. Well, and you know, one thing, because what I love is you get to come from that hygiene viewpoint where you were like, hey, a lot of times we're hearing it third hand and you're super stoked. And we're like, we didn't hear it,
What?
but we're sure it's great.
Right.
And I'm
Everything was
from that.
fine until you brought me this. Yeah.
Yeah, you plunked it down. We're like, aren't you excited? But what's funny too is I'm like, I always think of it as the doctor standpoint too, where I'm like, you know, doctors, we do get super stoked. We do hear about this stuff. And like right now, if a doctor's feeling like I am, I'm like already excited, Rachel, to go look this up and use it. But the thing that I always tell people is you have to like back yourself off a bit and get prepared before you present. So do come with, like, in my opinion,
Plan.
doctors, get yourself prepared. Get the research. Hygienists love research. They like to
Yep.
know what they like to be right. Like they don't like to be inaccurate. I find most hygienists that really bugs them. So like have your research ready, be able to tell them the why, make sure that you say, this is how much we're going to charge. And this is the code I want to have charged out. Talk to your billing people, get all of that stuff figured out before you come plunk it down and say, this is going to be amazing. I just think if you come prepared, your hygienist, you're not leaving so much open for them. Open loops and hygienists just don't go together well because they're detail oriented. Like I said, they like to make sure that, and I don't mean right in the sense of like, I'm right, but like they don't want to give inaccurate information.
Right.
and
Yeah. And they have to
so,
believe in what it is that they're presenting.
yeah,
And because
if you have that, yeah.
yes.
I just, that's what I have found with almost all hygienists I've ever worked with.
Yeah.
Is if I come prepared, even though I'm real excited, if I come prepared, have everything ready, lay it out for them so that they can see it on paper. They know what they're going to do. We practice the verbiage. And then I say, next week, we're going to practice again. And then I don't relent because every week we're going to be meeting every Thursday at lunch to talk about what's going to be happening. They all of a sudden will embrace it. But I do think there has to be from the doctor's side a level of preparation to come when we're bringing this stuff to them.
Yeah. And I would also remember too, like it doesn't all have to be on you, right? The manufacturers, trainers are there for that reason. So maybe part of the preparation is I've already reached out and, my goal is to launch this in January, right? It's almost November now, so we're going to launch this in January. So it's not like tomorrow we're going to start talking about this. That high quick starts, right? Like me, I'm like, well, why not? Why don't we just do it tomorrow? Everyone else's head is like on it, spinning.
Yep.
But we're going to start this in January, and so we've got time to like learn about it, ask questions, practice it, do it on each other. Like go ahead and order some and treat each other, maybe treat some family members, right? So we have some experience. So the first time we're doing it doesn't necessarily have to be on a patient. Sometimes it is, but it's better if it's not. And then once we have that and everybody's feeling ready, launch it and implement it and then evaluate, right? Have time to come back and evaluate and check in with the team. How's it going? What are you running up against? How is it going? Have some time set out to that. And then once you get really clear, then add it to your standards of care, which is just a document that we have for our clients running that, is in their practice of when we see this, we do this. These are the types of treatments that we recommend when we see these types of conditions.
Yeah, absolutely. And I think that's exactly it. It's like there just has to be a plan in place. They just have to feel supported. But then they also have to know we're going to do this. But there's a plan to support you in place, hygienist.
Yeah. Exactly.
And I will well, actually, let me just check in though. Anything though that you noticed or you hear from either side more or less when you talk to people?
So I'm not talking to a ton of hygienists, but what I did want to say is one, I'm very excited about the Curidon thing. And I was looking up the JADA studies as we were talking about it. And maybe I'm like that, fact finder hygienist at heart. I'm like, anyway, so I just find that super interesting. But I think what you just said is hey, we're going to be doing this, but we're here to support you. I think too, it's going back to the, giving them tools to do their jobs to the best of their ability. Like you guys are seeing situations where these things are arising and we don't have a solution for it yet. Here's a new solution. Like, let's try it, together as a team versus here's the thing that I just heard about on this webinar and now you're going to implement it. Good luck. That's
right.
It's going to be met with some friction if it's presented in that way.
Right.
Yeah.
Especially if you
Yeah.
start with the words, here's something that can help your production.
Yeah,
Yeah.
that's not what they're motivated by.
I'm always like, don't talk about that, and don't start with 3.3 times your pay or anything. Don't do that.
Yeah.
I'm like,
Yeah.
let's
Don't do
start with
that.
instead, here's the
So
cool
here's
things
a
you
way,
can do to
yeah,
help your
here's a way
patient.
we can make you profitable.
Yeah, yeah.
Um,
Exactly.
so, and I would say the other thing too is, practice leaders, whoever you are, it's not just the owner, right? It's associate doctors, it's lead hygienists, it's people who are, it's practice managers who are in a leadership role. Like, you've got to talk about it too,
Mhm.
right? You can't just leave it to them. You got to talk. So, because if you're excited about it and patients are accepting it, then we lead by example, right? That's just it, it just works. It works that
Absolutely.
way. So, yeah.
Well, and that's something even on, to go back to this, because this will be on our hygiene cards. We have these little hygiene exam cards. So that way, every time, every single exam, our hygienists are looking at the same things. And one of the things that's on our card is, do I need the doctor to reinforce fluoride?
Mm,
Because a lot of times the patient's like, I mean, do I really need it? And the hygienist's like, because we always link fluoride to a risk factor. Well, what
yep.
I'm concerned about is you've had fillings every appointment the last 2
Yeah,
years, and you've
exactly.
got recession. This is the most, so link it to something, and then they will
Yes,
circle,
always.
you know, they'll circle,
Yep.
I need you to back me up, doctor. That way the doctor can come in and go, did Amy talk to you about placing fluoride there? Because I'm really concerned that,
Mm-hmm.
this is going to come down
Mm-hmm.
the pike. And then for the patient, it's almost like a sealed thing for
Mm-hmm.
every time to come. So, I think that is really important that associates, other people, even our front office team knows kind of our pillars of care, our standards of care, because it's important that they can talk
Oh,
about it,
yeah.
as easily as anyone else. If our
Yeah.
treatment planners
Oh,
aren't like, yeah, that's really important, and this is
yep.
super important in preventative health, and I know why the hygienist did it, the patient's just looking for a hole potentially of, should I not do it? So,
Right. Exactly. No, I 100%. And so so one of the things that we were going to talk about, or I was just going to mention, is talking about creating your standards of care and having that perio foundation is our perio boot camp. And we recommend the whole team go through the boot camp together. When we do our in-office workshops with our clients, the whole team is there. Like, it's not just about hygiene, because we can't work in a silo. That just doesn't work. We need everybody's support. And so the business team has to believe, like, oh my gosh, yes, do you know, like, yeah, this is $60, but if this grows into a bigger filling, it's going to be, $160 the first time you fill this tooth.
mhm.
And then in 10 years it's going to be, $460, and eventually you may need to have a crown. So, it's just they have to believe, everybody has to believe, like, this is in our patient's best interest.
Yeah. Oh, for sure. Hey, can you put some information for that boot camp? Because it's all online, right? Or is
Yeah.
that the one I'm
Oh,
thinking
thank
of?
you. Thanks, Ashley. Yeah, so she just
Okay.
dropped the
I
link
got
in
it.
the chat. And also, if you wouldn't mind, DSN members get $400 off. So it's all caps DSN 400. And so the cart is open to until tomorrow, Friday, October 20th, at about 5 o'clock Eastern-ish. If you're watching this after, just message me. You can send me a chat and we'll see if we can work something out. I would say, through the end of the year at least. But yeah, go grab that. Go grab that, because then if you get it now, you'll be able to take advantage of the Q&As and some of the support that's coming up soon.
Yeah.
But yeah, to the dental public, it ends tomorrow, and we only open this up to non-private coaching clients twice a year. So yeah, and also this is the last year that you'll be able to get it and have indefinite access to it. We're going to do some type of renewal system next year. So yeah, it's a good thing to grab, and it's just a good foundational program. You can have new team members watch it regardless of their position. And yeah, we've been presenting this in updated formats, but we've been doing this for about 10 years, and it's a critical piece of our private coaching client success. Because any type of change, it's a process, right? And it takes time. And that's why what you're suggesting, Summer, with having that plan, it it's different. It's a different conversation that the team is having with the patient. So they need some time to process it, to kind of accept this is coming, to adopt it, to think about their belief systems and get those aligned with what they're doing clinically. And so that's why I think a lot of times things do fall by the wayside, is they haven't had that time to really process the change. And by the way, they feel like they don't have any say in it. So if you start having the conversation of, what do you think is the best way to incorporate this? You
Mhm.
know, what are some things that you can think of that we want to look out for? Like, do we need to have a doctor exam before we place Curodon? Like, there's different things that are going to come up. And if they have input into that, and if they have input in that standard of care, they're a lot more likely to really respond and honor that.
Absolutely. Well, and it's funny because that was my conversation yesterday was, you know, same thing about how to introduce it. Cause, you know, it was almost like, well, what KPIs do I put around it? And I'm like, you don't yet. You do all of this conversation first.
Yes.
And I said, what's crazy is then often they will say, when you say, how do you know you succeeded? What do we want to look for? How do you think, you know, you'll know when you've succeeded? Well, you know what I might do is, and I'm being the hygienist now, I might track, you know, how many people I presented to and how many said yes.
Exactly.
That's great.
It's a
And I
great
said, you know,
idea.
a lot of times, you know, they'll define what success looks like
Mm-hmm.
once they have done it and incorporated it for a while. But I'm always
Yep.
like, give it a couple weeks before you even say, okay, now that we've kind of got our toes in the water, we're feeling good about it. How do we
Yep.
define success? How do we now decide this was something successful? We're using it well.
Yep.
And then it's crazy how they often will come up with their own metrics at that
Mm-hmm.
point. If not,
Mm-hmm.
you can lovingly give them, well, what do you think this? You know,
Yeah.
but I agree, it should be an open dialogue because, like, the whole thing needs to just keep coming back to we're getting people healthy. This
Right.
is cool.
That's
We're
right.
getting people healthy.
Yep.
So I love that because that actually was kind of one of my main things was why do hygienists not implement? And I think we kind of said this is probably one of the main reasons
Mm-hmm.
is a lot of the doctors are quick starts, are excited, are passionate.
Yep.
And hygienists just need to be able to warm up to the idea, to know the
Mm-hmm.
why around it, to have the verbiage, to have the support, to have the team support, um, have the doctor's support, you know, all associate support. And
Mm-hmm.
they need to be able to have a say so in how that's going to continue to
Mm-hmm.
look and what might make it
Yeah.
better.
Yeah. And it has to be aligned with, you want to have a culture. Well, I say you want to. If we are continually expecting our team to up level their skill set and what we're offering, that is part of our culture, whether it has been communicated or not. But I think it's fair to them to say, hey, this is part of our culture, is that we are continually evolving, we're learning, and we value that because it keeps us engaged as providers, and it keeps us providing our patients with the best impact, the biggest impact. And so I would say, if you're not seeing it happen, what if it's not happening week after week, right? First thing is, tell me where your obstacles are. What's coming up for you? And just listen. And you can just let them just go and just listen. Try not to, like, this is hard. Try to listen to understand instead of listening to respond, because you're going to have a lot of responses in your head. And then see, like, if we need to go back to that standard of care that everybody agreed to, right? We developed this together. It wasn't just a dictate, that came
Mhm.
over. And then go back to that, this is one of our core values, is that we are continually learning and advancing, in the services and technology that we can provide our patients. So this is the direction we're going. But and I want you to go this direction with us. So what can we do to support you in that? And it might be, I just feel like the schedule's been crazy lately and I just can't add one more thing to my brain. Okay? Fair enough. Like, how do we address that?
How do you address that? Because there are hygienists. That's
That's a whole
exactly what they're going to
nother,
say.
yeah, that's a whole nother conversation. No, I mean,
We're
that's
gonna
part
need
of the
another
one.
hour, Summer.
I
We
know.
will, because honestly, that 1% perio that we talked to, their open time was 2%. So those two things are directly related. And if the hygienist doesn't know that they have time to do a procedure, they're like, I'm just going to do the best I can for this patient today, and I'm going to see if I can figure it out next time. But if nothing ever changes in the schedule, then nothing is ever going to change in their procedure recommendations, likely. You know what I'm saying?
Mhm.
Like,
Right.
there's so many factors that go into this.
Right. I know that is going to be another conversation then of how do we actually talk to hygienists about things just like that? Because time is usually one of the big ones. And a lot of times I tell doctors that you know, if you've been a doctor for a while, it's sometimes like a closet. I said that like we keep accumulating articles in it and we never take stuff out. Sometimes it's just reassessing what's in the closet and being like, hey, is this still serving our patients well?
Yeah.
And
Is
when
it
you're listening
necessary?
to understand, sometimes that's what they say is like, well, I'm trying to do this, I'm trying to do this, I'm trying to do this. Sometimes you're listening to it and you're like, what if we didn't do this and instead we just did this? How would that feel?
Yeah.
So sometimes when the time thing comes up, I just like to readdress. I totally hear you. I can see where you're coming from with that sort of feeling. Tell me what it's looking like then in those appointments. Is there just a piece of clothing we need to take out
Yeah,
to,
and
to
honestly,
free you up?
there's so many things that are coming at us right now from a technology standpoint that it's a lot, but it's also amazing because there are some things that are going to eliminate some of the old school steps that we've always done, right? Like manually charting. When I say manually, like entering existing treatment. We're not going to have to do that for very much longer. There's going to be there is technology that's, out there that's going to do that for us.
Yeah,
So there are going to be some things that are going to eliminate some steps so that we can add some other things. But yeah.
yeah,
So
yeah.
that brings us to another topic. So I'm doing shameless plugs tonight, so we'll
Please,
just say that.
please.
So we have a free, we call it our virtual growth forum. We do these every 2 months, and we try to have a hot topic in the hygiene for practice owners and hygienists. And scheduling is the next one. So it's coming up on November 7th. And I think Ashley has that document. Yeah, so you guys can scan this QR code and register for that. Everybody's welcome. We try to keep it interactive, and we're going to talk about assisted hygiene model and some other alternative hygiene scheduling models, things to think about as we're in this place where some practices have more patient demand than they have hygiene hours, or they have amazing dedicated hygienists, but not enough of them, or they just want to look at other ways to be efficient and have support for their hygienists as they're implementing all these amazing things.
Yeah, awesome. Such great resources, truly, that are like right here at DSN Doctor's disposal. So I'm glad you did do a shameless plug because people really do want to have these sort of resources.
Great.
So it's actually
Happy to
just really
provide.
generous. Thank you for your
My
offer for
pleasure.
sure.
Yeah,
So really
absolutely.
just to wrap it all up, I think what we decided was, fundamentally, if you're looking to if really the goal would be to help our hygienists be more profitable, it really does start with just your standard your standards of care and bedrock foundation of
Yep.
perio, first and foremost, making sure we're actually getting patients healthy with the oral systemic link. Ensure that that's where you start. And then when you're ready to add adjunctives, you talked about Curodont, PerioProtect, Hyben X, OraCare, Elevator, some things to kind of look out for, which I don't know if we could
Yeah.
post some of those, Ashley. I could get it to
Yeah.
you, or it's in
I've
there,
got some
obviously.
links too that I'll share with
Yeah.
Ashley. And Phillips, I always have to give them a plug too. They've got a new power flosser that's amazing. And combined with all of these things, because that's the thing, right? We all know it's multifaceted, right? And having
Absolutely.
patients participate at home too is super important.
Yeah, absolutely. So we can list some of the products out, but maybe just start with the one and really start to set up meetings
Yep.
to start just having the conversation. Like I said, doctors come ready with some of this information, even if it does mean setting up the rep, but knowing that you're going to be the kind of part of that steam engine that's going to help support and drive this as well. Talk about the why always. Help them understand what the outcome we're looking for is. That's going to save the patient's time, money, resources, whatever is going to benefit that patient. I think the why and the benefit for the patient are the two biggest things hygienists care about.
Yeah, I agree.
And then talk about the obstacles that will come up. What are the contingency plans kind of that you can discuss, the verbiage you can discuss around them, and then come back in a week and have a different discussion after you've utilized it for a bit. The perio percentages are somewhat, it's a good number to shoot for, as you were saying, the 35%, but it's just a number. Actually treat the people and recognize that that's a number that people sometimes, try to shoot for. Anything else, guys, though, as we wrap everything up that I didn't cover?
I don't think so. I think we just, like you said, nailed down what Rachel will be on next. The next
I
time we
know.
can get her on board.
It truly is one of the biggest things I talk about is how doctors should talk to the hygienists. You know, because it's almost like they feel like they're adversarial. And I'm like, I don't think it needs to be adversarial. You just have to recognize that just communication wise, it's often very different, you know, like you were saying, how they absorb and how they understand. So that might be a whole nother topic that we discuss is communication with our hygienists. So,
So I
Awesome.
do see
Right.
a question here. Yeah.
Go ahead.
Can you touch on Elevate SDF versus Curidont? Yeah, great question. So Elevate, and here I am not going to be the expert on either of these, but I'm going to tell you my understanding. SDF halts the decay, right? Stops the decay, and it's a very valuable product. I don't know that it has to be one or the other. I think there are different applications for these products. And there absolutely is some overlap. SDF halts the decay. Curidont actually repairs the enamel. So it rebuilds the enamel over that area. So it halts the decay and it rebuilds the enamel, right, in that demineralized area. There's also no staining, so there's no discoloration with Curidont. So that's just a basic explanation of that. Good question though.
Awesome. Thank you.
yeah, thank you guys. Thank you for your time.
Thank you.
Thank you for your expertise. Ashley, thank you for always hanging out with us and bringing your perspective, which is always so good. All right. Well, we will see you guys next month. We will schedule Rachel to come back on and do communication with our hygiene team.
Absolutely.
Love
Thanks,
it.
guys.
Awesome. Thank you,
Thanks,
ladies.
guys.